Welcome back to the Sickle Cell Action Network. I'm Gary A. Gibson, your host, brought to you by Martin Center Sickle Cell Initiative and sponsored by Mass Therapeutics. We're talking about depression and sickle cell today, and during the break we had a really lively discussion that we thought we'd come back and share with you. One of the things that is an issue when it comes to sickle cell particularly is the fact that patients often have to struggle with the on and off again use of opiate medications, narcotics, morphine, things like that. And it's something that I think a lot of people, even those within the community, don't think about as being an issue. But when you are someone who doesn't want to be addicted to sickle cell, and you are in a very bad pain crisis and you go to the hospital and the only thing that helps you is opiate or narcotic, and then you come out of your crisis and you go home, you have to fight the natural tendency for your body to want more of that. And during that discussion, we thought that maybe we should share some of this with our audience, is that it sort of feeds into the progression of depression. And so, Barbara, you were quite vocal about it. And Bob and Mike, you also were too. But from your perspective as a patient, Barbara, tell us a little bit about that fight. As far as the fight, how do you get through this on again, off again battle with the natural inclination? Tell us a little bit about that fight. As far as the fight, how do you get through this on again, off again battle with the natural inclination for your body to keep asking you for more, morphine?
I have to have an advocate, my husband, my friends. I have to keep my mind above water. If you don't have friends to help keep you moving, you lose ground. I have a good friend that knows my personality, several good friends, and they know how to keep me going and pushing. And my mom, which was a sickle cell patient, she wouldn't let me stop. After I had a severe crisis, she told me maybe after a couple of weeks or 3 weeks, it's time now to get up and get moving. Whether we went to the mall and walked, or a church service, or went to visit friends. And I may, still be a little achy, but she said it's time to get moving.
So you have a support network.
Yes, I do.
And it sounds to me from our previous discussion during the break, Bob, you mentioned that you work with patients that don't necessarily have such a support network.
Yeah, one of the things I had mentioned before was that thankfully, Barbara has a very good support network. I call them resources: a family that loves you, friends, loved ones, church, something going on, a husband, kids. And a lot of times, unfortunately, we have some patients who don't have that, who don't have friends, who don't have a supportive family, who don't have kids, who don't have something pushing them from behind. And so part of my job, a lot of times when I work with our patients, is to go in, assess the situation, see what they have, what they don't have, where they're lacking, where they could benefit from resources, and provide resources to them. And each person's individual, and some people do have a good family or do have children, but they don't have a daycare for their kids, and so they're constantly watching their kids, which then sends them into a stress management dilemma, and then with that stress management comes depression. A crisis is right down the street, and then they end up stopping in crisis for 3 weeks in the hospital. And so one of the things I would work with them is finding daycare services during the day, because then when you're hospitalized, you're on the high the big wig drugs, the CAD machines and all, the Loudens and all that mess, and then that has a tendency to slow you down and numb your pain for a little bit, but it also can bring about depression, especially when you're discharged and your body's going through detox from the medicine. So I think that. Meeting the patient where they're at, giving them a proper assessment, seeing exactly what they have and what they don't have, is what I try to do to alleviate some depression.
Mike, do you have any additional thoughts that you'd like to add?
Actually, no.
Okay.
These two folks have explained it very well.
Great. There are a number of stories that. A number of studies and papers available about the prevalence of depression among people who live with chronic illnesses, Mike. As the director of a crisis and suicide intervention, have you encountered situations in which chronically ill people have contacted you for help? And if so, would you please tell us a little bit about some of those encounters?
Yes, Gary, it happens every day.
Every day.
People with a terminal illness, with a chronic illness, with an acute illness where they can find no hope, they can find no relief. What have they got left to look forward to? Why do they want to continue living, knowing that the rest of their life they're going to be in this pain? I mean, imagine for those of us who have never experienced sickle cell anemia, the worst toothache or the worst backache or the worst headache you've ever had, multiply that by 10, and then not only does it stay with you, but it's with you all the time. You can't take an aspirin. You can't rub on an ointment. It's there all the time. And when someone is beat down that much, they're trying to get up. They're trying to reach out. But as we talked earlier, Barbara and I, they're sick and tired of being sick and tired, and that it's robbed them of their energy and their strength. And sometimes it's all they can do, just to talk, just to be motivated enough to talk. And so those that can, when they call the crisis line, we're there to meet them non-judgmentally, in a compassionate manner.
That's really important.
Yeah, we don't tell people what's right or wrong. We're there to offer structure and support and maybe some perspective to try to encourage them to come up with a way forward. Not a way out, but a way forward, because they know that there's only so much that can be done. And there's no use trying to sugarcoat it in any way.
Barbara?
Another thing that we haven't touched on yet is financially trying to keep your meds going. It breaks you. So, and also with the new laws, I can barely get my regular medicine, less known than getting a narcotic or opiums that help you after a crisis. It's very hard to get your pain medicine now. So financially, you're disabled, and they only want to give you maybe 10 tablets for the next 2 weeks, and you need that tablet maybe every 4 hours.
Right.
So that doesn't work.
And that also adds to the burden and the stress. And we talk about stress quite a bit. We know that stress is a very important factor that needs to be controlled when and where possible, because the stress itself actually helps bring on crises.
Stress brings another crisis.
Right. So Barbara, one of the reasons that we asked you to be on our show today is because you seem to have found the way to deal with life without letting depression control you. So as one who has lived with sickle cell on a daily basis for many years, would you please tell us whether you have had periods of depression? Let's be honest. And if so, what was that like?
Yes, I have battled I've had bouts of depression. And it was, it's almost like you're in a place that's called nowhere. It's like you're in a dream or something that you can't get out. Just an empty place. And if it was not for my husband sometimes, and my girlfriends that were really close to me, reminded me, yes, we're here. Yes, I'm here. Don't worry, this will be over soon. Just keep going for just a little while. And imagining sicklers that do not have that support or anyone to talk to, or anyone that will talk to them and remind them that it'll only last a little while. Hang in there. And most of the time, as we were talking, I did my withdrawals cold turkey. I didn't even realize it till a girlfriend of mine told me. And it gets harder as you get older, but I'm still doing it.
Wow, okay.
Because I want to live, I want to exist. And I remember calling my doctor, and I said, Doc, I'm going to kill everybody in my family if you don't give me something. Because everybody was getting on my nerves. And he said, hold it, you're going to be fine. And he gave me a little bit of medication that I took for a little while. I got better. But yet and still, if I'm a typical sickler and I don't have the money to pay for that extra medication, I'm still in dire straits. Luckily, I've got a pretty good insurance plan that I can work with, and that has helped me get over some of these bouts. Now, I will tell you that part of the depression that I've had, I think is just that I've been tired, just like Mike said. I've been just
Tired of being tired.
Yeah, tired of being sick and sick of being tired.
Mm-hmm.
So, but we keep going. I have to keep going.
That's awesome. And I think your description of depression as being no place,
Yes.
being in a place that's no place, that's pretty profound. Wouldn't you say that, Bob? That's pretty profound.
Definitely. I mean, so many people are living with living with depression, and it's every population has different needs, and mental health added on top of is an additional stressor on top of any additional medical concerns. It just magnifies the life stressors. So, and it's especially important to understand that minority population, especially those that are victims of systematic discrimination, increased poverty, lack of empathy, social stigma, have extremely high risks are extremely high risk for developing or fostering depression, just because of all those additional stressors.
Right.
And then when you add sickle cell or any other chronic disease on top of that, it's a recipe for some serious mental health issues.
Right.
And unfortunately, again, as I mentioned, it's that stigma, that social stigma. There's a universal social stigma that exists about depression, about mental health, and it does not. And I tell patients, if you break your arm, what are you going to do? You're going to go to the hospital because that's a physical trauma to your body. If you're experiencing emotional traumas, you're going to want to get that assessed by a professional as well. And I think equating the physical with the mental helps people understand a little bit better. But I still think that unless you're. I mean, and you have some people out there. Men are less likely to go to the doctor than women, unless something's hanging off and bleeding. And
right.
So I mean,
right.
But I think that allowing people and helping remove some of that stigma associated with mental health opens the door for appropriate treatment.
Mike, is there anything you'd like to add to this part of the discussion?
Depression robs us of our mojo. It's like if the house catches on fire and I happen to get out, great. But if I don't, well, that's probably okay too.
Huh.
It's very insidious. And someone who that's why I find Barbara so inspirational.
Right.
Because in spite of some very, very challenging circumstances every day, you make the conscious choice and decision to get up, put one foot in front of the other, and you are a real beacon to those that know you and other people with sickle cell.
And that's why we wanted her on the show with us today. The Sickle Cell Action Network is brought to you by Mast Therapeutics, and we are glad that they are with us, sponsoring us. Mast is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified polaxamers. Mast has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. Mast is currently enrolling sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Polaxamer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery and may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It also may reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. Interested patients should know that EPIC participants will continue to receive their normal pain treatments during crisis, and that there is no cost to participate. Interested patients should also know that participating in this study could not only help themselves, but might also help future generations of those yet to be born. If you're interested in learning more about the EPIC study, please visit www.theepicstudy.com. With that, you're listening to the Sickle Cell Action Network. Welcome back to the Sickle Cell Action Network Internet Radio Show on RadioNext.tv, the Cool Groove site. My name is Gary A. Gibson. I'm President and CEO of Martin Center, and I'm your host for the show. Today we're talking about depression and sickle cell with a great panel, giving us a lot of information, also giving us their heart and soul. I'd like to start with another question that I'm going to direct at you, Robert. You provide social work services to people with sickle cell disease and hemophilia too, don't you?
I do, yes.
First of all, I just kind of want to know, are there any differences that you see in the needs for the two patient populations that you serve?
Well, I mean, I think that each population has their own need. Each person has their own need, but like I mentioned before, minority populations, there's especially high risk for discrimination and I think that's anytime you have a chronic medical condition and then you add anything on top of that, any life stressor, it just magnifies it and it blows it up more than it should be.
Okay.
So, the hemophilia population is different than sickle cell population, which is different than, but just like you're different dealing with a male versus a female versus, an impoverished person versus somebody who has access to resources.
Okay.
So yeah, there are differences, but depression affects everybody the same way.
Good, good. Secondly, how often would you say that you see signs of depression in sickle cell patients, and is that about the same level that you see in patients with hemophilia?
I would say again, it all depends, and I have some population, some of our patients. First of all, there's a trauma. There's a trauma associated with being born with an incurable chronic medical condition, and anybody who has that is at risk for high risk for depression. Access to resources, like Ms. Barbara mentioned earlier, how she had her mother and her husband and her kids and her career and her job, and she had to get her husband. She had to get back to all these things when she came out of crisis. I mean, if you have nothing, if you lack the resources, you're more likely to kind of marinate in that depression. So resources are very, very helpful for folks.
As we look at the landscape for sickle cell, we see, not only is there the severe pain, the unpredictability of the pain, unpredictability from the point of when will it happen. Another part of unpredictability is how long will it last. Mm-hmm. And that's part of it. The other part of it is, everyone with sickle cell is aware, at least to some degree, of the mortality statistics, and they have to live with that. As Ms. Barbara said while we were on break, the financial issues, which I call financial pain. These are all things that compound on a person, an individual, and it's asking a lot of anyone to be able to say, what do you have to do to be able to keep going, because there's so much to deal with. And that's one of the reasons why when I see someone like Barbara, and others, of course, there's many others, but when I see someone like that who is a strong fighter, who keeps going in spite of all of those obstacles, I'm just amazed. And I wonder, honestly, myself, how much could I take? And I'm sure many of the people that know people with sickle cell also wonder the same thing. And it's perfectly understandable, because what people with sickle cell have to live with is quite a lot. Barbara, a while ago I asked if you had experienced any battles with depression, and let me ask you, did you ever seek professional help? And if so, what convinced you to do that? And if not, what kept you from doing so?
Well, I did. I went in, I talked to my doctor. He told me the first time, wait, I think it was in the winter. He said, wait till the spring when the sun comes out and you should feel better. And normally that would have worked. And then, like I said, I waited till then, but then the next winter, and it did pretty well. I did pretty well waiting and standing in the sun, 15, 20 minutes a day, or making sure I went out and enjoyed outside. But the next year, like I said, I just told Doc, I'm going to kill somebody if you don't help me. Mm-hmm. And then he said, hold it, okay. And I've got a great doctor. He recognized, I think, what was in my voice. And that's part of support also. If you got a doctor that knows you, and I've been with my doctor for 35, 38 years, he said, okay, hold it, let's try this for a little while. And it seemed to help. So yes, I did seek some help. Okay. And but I didn't want something to control me. Mm-hmm. after a while, I decided, okay, I'm going to come off of it. And he gave me a very small amount because he said, you don't really need this.
Mm-hmm.
And after a while, I did wean myself off of it. And then after a while, menopause set in.
Okay. Another battle.
Another battle. So after that, he gave me a little something. And that worked for a while, and I guess my brain cells got back together.
Okay.
So,
I think you said something that's very, very important, and that is talk to your doctor.
yes.
And as we continue the conversation, we're going to talk a little bit about warning signs or things like that. But if you feel that you are battling this depression and you feel that you're finding yourself in no place, as Barbara said a little earlier, then maybe you should talk to your doctor. Would you agree with that?
Yes.
Okay.
Very much.
Mike, many times people who are depressed are not really aware that they are. So what are some of the signs that they or their loved ones should look for? And let's consider the fact that there is a support group, some caregivers, some loved ones around. So maybe the patient themselves can't recognize it, but maybe someone else can. So could you help with that and give us some idea what kind of things should people be looking for?
Certainly. One would be fatigue and decreased energy. You can certainly observe that in a person that you know. Also, you will notice this sadness, that there's no joy in life, that they don't get excited about things anymore, that they withdraw, they isolate, just be in their room all day, maybe not come out until it's supper time or whatever, and then go back. They don't read, they don't watch TV, they just sit there and stare off into space. Oddly enough, people who have short tempers or short fuses, they can be irritable. They may snap your head off, and then after that has passed, they'll say to themselves, well, why did I do that? I mean, that was seemingly insignificant. That irritability. Mm-hmm. And what happens is, to the person that's directed at, they become very defensive. Well, what did I do? It's like you're walking on eggshells all the time.
Mm-hmm.
What you may say to that person today isn't going to work tomorrow, or may be the wrong thing to have said tomorrow. If you notice changes in the sleeping patterns, sleeping all day long, or up all night, or up and down, not being able to get out of bed in the morning, as I alluded to earlier. Appetite issues. Some people handle stress by eating. Mm-hmm. or by not eating. Mm-hmm. But again, just because a person has a particular symptom doesn't mean that they're depressed. It's taken in context with everything else that's going on in their life. Even persistent cramps and headaches, memory loss, digestive problems can be an indication. And as Miss Barbara said, that persistent, sad, anxious, and empty feeling. All of us like to make sense out of why things happen to us in our lives the way things do, especially the bad things. When there has to be reason for it, cause and effect, logic. There must be something that's causing this to happen to me. And when we're not able to attribute it to something, well, then we have a tendency to blame ourselves. Well, it must be me. It must be something I did. It must be something I'm being paid back for, something I did or I didn't do. And that just contributes overall.
So we start adding guilt to the picture.
Exactly. And that is so difficult to combat when you're in the throes of a crisis.
Yeah. Wow. Well, Bob, as a practicing social worker, what are the signs you're looking for?
I work in a medical office. I work in a doctor's office, and so some of the things I look for with a patient is not participating in their care or in the care process. They've missed appointments. They're not taking their medicines. They're taking too much medicine. They're isolating themselves. They don't go to church anymore. They don't go to support group anymore. They don't go to anything. They're just. I say, well, when's the last time you went to your group? Well, it's been 3 months, or they have increased hospitalizations. People who are depressed spend a lot. You go into the hospital room and the lights are all off, and it's dark, and they're groggy, and they're doped up on medicine because they're in pain, right? That's very depressing, and. So if there's like some sort of increased hospitalizations, sadness, substance abuse, are they drinking? Are they drugging? And is that normal for them? Lack of formalized support system. If I meet with somebody and I see that they live at home with their mother who they don't really care about, who doesn't really care about them, they get their, you just, that will definitely lead to can increase your risk for depression. Again, what Mike mentioned, the weight loss, weight gain. I have patients who get real big when they're depressed, and then I have patients who look sickly as sickly can be when they're depressed and lose so much weight. Just various signs and symptoms, and I work with the doctor, the nurse practitioner, the PA, whoever it is, to figure out, is this normal for them? Because I'm relatively new to the practice,
right.
and I say, is this and they're like, no, this is not how they operate, or that's fairly standard for them, and
okay.
So those are just some of the
okay.
clinical signs.
Okay.
In office, doctor's office, clinical signs we look for.
Barbara, did you ever notice these things happening with you?
Yes, I did a couple of times. I remember I would sit on the couch and just cry. I didn't know why. And then I told my husband, I have no friends anywhere. I said, they really don't care about me. But they really did, and he did.
Mm-hmm.
And my dad did. But at that point in time, nothing mattered.
That's how you felt.
Yes, that's
right.
what I felt.
Right.
That no one cared. I was in this all by myself. But I knew underneath, mentally, that's not right. So maybe that was just, my spirit, Lord underneath saying, oh yes I am. I'm with you always. So
for those who are caregivers and family members and friends, be on the lookout for these signs. If you notice them, first of all, try to ensure that the person that you're caring for or that you love that has a battle with sickle cell, ensure that they know that you're there for them. Ensure that they know that you care for them, and ensure that they know that you love them. The Sickle Cell Action Network is brought to you by Martin Center Sickle Cell Initiative. We are a 46-year-old community-based organization in Indianapolis, Indiana, providing services exclusively to people with sickle cell disease. We have a support group. We have a food pantry. We provide Gatorade and other hydration products free of charge to our client members. We also have emergency financial assistance and transportation assistance, among other services that we offer. We provide education in our community by participating in numerous health fairs each year, spreading information and sharing awareness about sickle cell disease. But because we believe in action, We also advocate. We go wherever we can and get in front of whoever we can to say we need more assistance to help people battling sickle cell. That's who we are at the Martin Center Sickle Cell Initiative. We're happy to have the opportunity to work with RadioNext.tv to be able to bring our message to you on a weekly basis. And with that, we're going to take a break, and we'll be right back. Welcome back to the Sickle Cell Action Network on RadioNext.tv, the Cool Groove site. I'm Gary Gibson. I'm your host. I'm honored to have the opportunity to sit here with three very remarkable people who all seem to care a lot about trying to get some good messages out to people that are living with sickle cell disease or living with sickle cell disease in their midst. I'm going to go to Mike with this question. Mike, you've told us about the signs of depression to look for. Now let's talk about coping mechanisms. What are some of the things that people can do to help them manage their depression?
Well, the first thing, Gary, is for them to reach out for help to their doctor. There's no shame in going to the doctor and telling the doctor that you think you could be feeling better than you are and have been, and then describing those symptoms. It's not a character flaw, it's not a moral failing, it's a medical condition, and there's reasons why people feel that way. They could be biochemistry reasons with a chemical imbalance in the brain. It could be a genetic issue that contributes. As we know, depression sometimes runs in families, other mental illnesses. People with low self-esteem are easily overwhelmed by stress, or who are generally pessimistic appear to be more likely to experience depression. And then there are environmental factors like continuous exposure to violence, neglect, abuse, poverty. They make some people more vulnerable to depression as well. As far as treatment is concerned, there is psychotherapy. Psychotherapy includes both talk therapy and perhaps medication. And there are many types of modern medications now that don't have the unwanted side effects that antidepressants of yesteryear have.
Okay.
I tell people finding a doctor, finding the right medication, and finding the right therapist is like buying a pair of shoes. Many times you have to try on several pair before you find a pair that fit, that don't pinch, that don't hurt your feet, that don't cause blisters. It's the same way, and lots of folks, and understandably so, may have a poor experience the first time they do see a doctor over depression. But all I can say is to keep trying. There is a reason why you feel the way you do, and it is not your fault, but it is your responsibility to manage this medical condition. Exercise is a good mode. Having a daily regimen, having structure to your day, eating healthy, getting the proper amount of sleep, forcing yourself to get up in the morning, take a shower, and put on a set of clothes that makes you feel good, just to get you started. Those are tough when you're in the throes, but on the days that it isn't quite as bad are the days that you can make progress.
Wow, that's a good list, Bob. And I think it's very helpful. And some of those things are just tremendously important. Bob, do you share any of these other coping techniques with those you serve? And if so, please explain.
Yeah, I mean, I think that acknowledging your own personal limitations, knowing that, some things are bigger than you to deal with emotionally, and reaching out for help is a big. It's something that a lot of people can't do. But when you say, you know what, I'm at my wit's end and I need some help, that's a powerful thing.
And it's okay to say that.
Absolutely. I mean, I think you're doing yourself an injustice when you don't.
Right.
Recognizing when you're experiencing high levels of stress, which can then lead to depression. If you know you're going to be experiencing some big stressor in your life, plan accordingly. Have an outlet for stress relief. Or release. This outlet could come in the form of a support group, choir, church, bowling, volunteering, there are lots of different outlets for lots of different folks. Some people, I have a lady who I work with who volunteers at a community theater, and she absolutely loves it. It's a huge thing for her, and that's just what she does, and which is great. And when she has a crisis, she gets better so she can go back to her theater, which is fantastic. Know your allies, know your support system, have tools in your arsenal so that you could fight back. And these tools are your allies. These tools are your resources. They're your friends. They're your church community, your theater community, your whatever community.
Okay. So if you're listening and you're wondering, what can you do if you feel as if you're depressed? We've been giving you some good ideas. And again, we want to stress that this is really, really important, because getting depression under control can actually help you physically. The more depressed you are, the longer depressed you are, the more it's going to have an impact on your body. And if you're already dealing with issues that are the result of sickle cell disease, you really don't need to add anything else to those stressors that are hurting your body. So pay attention to this if you have sickle cell, and or if you know someone or care for someone with sickle cell. So Mike, do you have any other recommendations for those sickle cell patients that might be listening in today?
Yes, I wanted to explain that in Indiana, every county in the state has access to a community mental health center. Community mental health centers are mental health and substance abuse treatment providers that the state has contracted with to provide those types of services. And as such, the state requires them to charge on a sliding scale basis so that no one will go without treatment or therapy because of not having any insurance or have a limited income. In the Indianapolis metropolitan area, there are 7 of those community mental health centers. And I'd like to mention a website where our listeners can go to find that kind of help.
Please.
The address is www.iccmhc.org/providers. Now, when you get there, you'll see a map of the state, and you'll see a pull-down menu where you can put your county into the box, and then click, and it will tell you, based on where you live in your county, what community mental health centers are there for you to contact. And what I tell folks is, because the demand for mental health services far outweighs the number of providers, it's very typical that many times it can be several weeks before you can get in to see someone. So what I recommend is call every center that's on that list and make an appointment. The first 2 that can see you the soonest, call the other 5 back and cancel. Go to the first appointment. If it feels like a good match, you're comfortable, it's a fit, call the second one back and cancel. If the first one is not a good experience for you, hopefully the second one will. But that will maximize your opportunity to get in to see someone as soon as possible. For those that do have insurance, I suggest contacting the insurance company and finding out which psychiatrist, which therapist, which outpatient treatment facilities are in network. Find out which ones are accepting new patients and clients. Contact them. Many times when people are in the throes of a crisis, it's very difficult to see the forest for the trees. So the key thing to remember is help is available. But we can lead horses to water, and we all know the rest.
Well, we know that there are people listening to our show all around the country, and we believe there are people listening to our show outside of the country. But certainly within the United States, I would assume that there are other organizations like the one you mentioned in other cities, correct? Wouldn't you assume?
Yes, that's correct. And the web address that I gave is the trade association for all the community mental health centers in Indiana. So there are organizations like that that exist in other locales.
Okay, that's what I wanted to know. Bob, do you have any advice that you have that might help people with sickle cell better manage the stress that might cause or add to their depression?
The biggest resource is yourself. Don't be afraid of the stigma associated with mental health. Know that there is help out there. Know where to find help. And if you don't know where to go, speak to your doctor. Your doctor. I mean, if you're living with sickle cell disease, chances are you're connected to a doctor, and if you mention symptoms of depression or they're going to point you in the right direction. Talk to somebody. Don't hide from it. A lot of people want to hide from it. Again, it goes back to the stigma. It's so dismissive to hide from it, and it's not going to go away. It doesn't. I mean, it doesn't go away unless it's dealt with appropriately. So
does it get worse?
It can get very worse. Suicide rates are extremely high, and depression definitely can lead to suicide.
Okay.
So, and the thing I have written down here: be bigger than depression, because you are bigger than the symptoms and the feelings that you're feeling right now.
Right.
You're bigger than that. So. Know that, and act on it, and don't hide from it. And don't be afraid of it, because it's part of who you are. You have lots of good qualities, you have some bad qualities, and you got to deal with them all appropriately, and it's just part of the mix.
And Barbara, you as one who is continually managing your emotional state so well, what advice do you have for other patients who might be listening?
Well, the first thing is smile.
I like that.
No matter how badly you're aching or how upset, depressed you might be, just in your own private corner, just smile to yourself. Then don't let anyone tell you that you're okay when you know you're not. A lot of people will say, you're not that bad. You look good. How can you be depressed? But you know how you feel as a sickle cell patient. I would also say, eat well. If you put good food in, you're going to feel better. You may need to do organic food. You may need to take extra minerals, extra vitamins. You may need to do a little work. It's going to be hard to keep yourself above water sometimes. But if you make a good push, now I know that there are times where financially you can't really do it. But when you can, do the best you can on eating and exercising, even if you just walk around your house for just a little bit. Sleep as much as you can. Sleeping heals the body. And get good oxygen. I mean, I don't want to sound like my doctor.
But that's okay.
I think his regimen is working with me. I'm still alive, and I'm 61 years old.
Awesome.
You know,
I was going to get to that.
Oh, I'm sorry.
It's okay.
But if you smile a lot, people will want to help you more. It's a little hard to connect with people if you're depressed, and it's hard to smile, but do it anyway. And call your church or sorority and tell them to please feel free to call and come by, in and do the best you can. You know, it's hard, but you can do it.
Those are the best words you could ever say. It's hard, but you can do it. Thank you, Barbara. Thank you, Barbara Walters. Thank you, Bob Louden, and thank you, Mike Dunn. Great, each of you. Great performance today. Really appreciate you being here.